So I guess we can press record and.
Yes.
Okay. So the topic for today is going to be identifying and addressing what matters. And this is a reminder of our age-friendly 4Ms framework. What matters is on top on purpose, because what matters encompasses the other topics as well. So when we've talked about mobility, how does what matters to that individual affect their participation in therapy? How does what matters affect what they want to do with their medications, for example? So today we'll talk about what matters. The definition for age-friendly as far as addressing it is knowing and aligning the care with each older adult's specific health outcome goals and care preferences. So it could encompass topics of end of life, which we'll discuss a little bit today, but it could be related to patient-centered care and when do they want to shower and things of that nature as well. So that will be our focus, and we will not just discuss what matters to our residents, but just a brief review of things that matter to our teams. I know in other sessions we've really talked a lot about how we can help our teams to be resilient, to do their job well, and so I have just a little reminder of some of those things we've discussed previously, and we'll go over a workbook that was developed and promoted through the IHI. So these are some things that I threw out based on other sessions we've had. So team members in our facilities want to feel safe, in particular during times of outbreak or uncertainty. They want to feel seen and heard, that their voice matters, that they are valued in their work and respected. They also have needs daily and on a regular basis with respect to having the tools that are necessary for their job, staying informed about changes. That's been huge throughout the pandemic with respect to changing information and requirements and regulations. Also kind of knowing who to go to with questions. And in times of stress, having time and space and an allowance for decompressing, for being able to find self-care opportunities. So the other things that came to mind, just outside of our work life, we have family, income, needing to have purpose, needing to have growth opportunities, flexibility in our job and our home life, or trying to find balances. So I also threw some comments out on that. But the long and short of these what matters topics is we don't know what matters to that individual unless we ask them. And so the importance of providing a space to communicate what's important or what the concerns are, and having leadership and supervisors listen and be willing to hear and understand what the concerns are, I think is very important. So we'll talk more about our residents as we move into the tool that I will share today, and what matters to the residents in our facilities. This is just my list that I created. So a lot of times their physical and cognitive functioning is a priority, trying to maintain their ability to do the things they enjoy doing, managing symptoms. For some, obviously the focus is on improving and rehabilitating and getting home. For others that may be long-term, it's enjoying the environment and the food they want and the activities they want. They're in the building, making connections with family and friends, and making connections with CNAs and nurses and other team members. Their faith, their health, their family. So not different from any of us, right? Some of the things that are important. But again, the question needs to be asked. So we don't know the details of what is most important to an individual resident if we don't specifically ask them. And so that's kind of one of my take-home recommendations for today, is just thinking of that question and thinking about asking it creating opportunities to ask that question. So the What Matters to Me workbook is what we will focus on next, and it was made by Ariande Labs and the Conversation Project and promoted by the Institute for Healthcare Improvement. So the purpose of it is to help individuals with serious illness prepare for conversations with their healthcare team about what's most important to them. It's got very simple, straightforward instructions, and the newest version of the workbook has instructions for caregivers that can then work one-on-one with the care recipient to complete the workbook. They also have really great examples. Here's the question, here's a blank for your answer, and here's about 4 examples of what other people might put, what other people might say in response to that question. And then the end of it provides some recommendations on things to do next to continue the conversation. So the workbook contains 6 sections. It talks about a little bit about my health, about me personal, my care, my people, my healthcare team, and then next steps. So I'll briefly touch on these sections. The my health is basically a couple questions about what is your understanding of your current health situation, just an open-ended question to respond with respect to, in my own words, what's going on with my health. The about me is an opportunity to describe, for me personal, what constitutes a good day and what constitutes a really hard day, to just describe what that is. And that will definitely look very different, for different residents in our buildings. The My Care section is the bulk of the workbook, and it has a lot of great thought questions to promote some good discussion. And I just took screenshots. So we have the very beginning of the My Care section talks about how everyone has their own preferences about what care they want and don't want. And then it has multiple questions that are a scale where they can rate their response. For example, as a patient, I would like to know, on the one end, only the basics about my condition and my treatment plan, or every last detail about my condition and my treatment plan, or maybe somewhere in the middle. And then there's several open-ended questions regarding wishes and preferences. So for example, if my health situation worsens, here is what I want to make sure does happen. And here is what I want to make sure does not happen. And as I say, I really appreciate the examples. So I'll just point out the responses in the examples. For example, I want to stay as independent as possible. That's what I want to make sure does happen. And I want everyone to respect my wishes if I say that I want to switch to comfort care. And here's what I want to make sure does not happen. I don't want to be a burden. I don't want to end up in the ICU on a lot of machines. So just in plain words, what do you want to communicate that you're comfortable with happening and that you're not comfortable with happening? So the next section is My People, pretty straightforward, just listing the main people who you want to be involved in your care. So this is not a medical power of attorney. This is just a less formal accounting of who are the important people. Maybe they're not my medical power of attorney, but I have a strong connection with my niece. And I really want her to know what's going on if I were to get worse or if I were to be in the hospital. And then my healthcare team has spaces to list providers and social worker that may be involved in that individual's care. The last page of the workbook is next steps, and basically it encourages the participant to talk over what they've filled out in this workbook with somebody else, to talk it over with the people important to them, with their healthcare team. And then if they have not already done so, to identify a formal proxy decision maker and to continue that conversation. So the What Matters to Me workbook is a tool to guide the conversation. It is not a directive. So just to be clear that we have our legal directive documents, which I've listed there, including a medical power of attorney and a directive to physicians. This is not a legal formal document. It's a tool to help residents and their family or caregivers to have a conversation and to have some guided questions to respond to. So it could be used by a resident, by him or herself, if they're able to, or with the assistance of a family member or caregiver, or the assistance of their social worker there. So the things I wanted you to think about as we've reviewed this tool is, are there things you're already doing to help identify what matters to the residents in your building? And how do you envision either the social worker at your facility or other team members, or in a care plan conference, how would you envision possibly utilizing this workbook? And then if you prefer discussing kind of things related to your teams, what kind of things are you doing to help identify what matters to those staff members? And what things would you change to help make sure that you know and address things that are important to your team members? So that's the content I've got. The last slide is the link to the workbook that we will be sure to share. It's just a 6 or 7 page PDF file, and you can get it easily there online and print it off and use it.